Hey everybody, today we are giving you an anatomy lesson.
Hey everybody, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about anything and everything audiology.
And if you don't know what audiology is, make sure you hit that like button, subscribe to the channel, hit our notifications bell, and stick around. We're going to tell you everything we know about it.
All right, so today we're talking about the anatomy of the ear as it relates to the last two episodes that we have put out there about some basic audiological testing. And so we're in this series right now, if you're just catching up, that we are explaining all the different tests that we do as audiologists at our office so that you can have a better idea of what we're looking for, what we're testing, why you would have these tests done. And Michael had the brilliant idea.
Well, I thought it would be a good idea to actually explain from an anatomical perspective what we're actually testing.
Mm-hmm.
So not only do you know what to expect, but you know what we're really testing. It's not just stuff that we're making up on the fly. So what we'll do in this episode, we found a pretty cool tool. It's a three-dimensional kind of fly through of the ear that we can interact with and change and zoom in. So we'll walk you through the anatomy of the basic audiological evaluation that we talked about, as well as the analysis of the middle ear. So we'll talk about all of that coming up in just a moment. We're going to take a quick look at the anatomy of the ear. We're going to start with this picture, and I've made my mouse a little bit larger here so you can see it easily and follow along. But as we're doing our audiological testing series, I think it's really important to understand exactly what we're talking about. So far we've talked about the basic hearing test, and we've talked about how we test the middle ear system. So this is just a picture. We're going to switch over to a 3D model. I want to make sure to credit the University of Dundee School of Medicine for this picture. We have a 3D model that they have put together as well that's going to be really helpful. I love both of these things, so just make sure that they get the credit that they deserve. But as we're looking at this is kind of a cross-section of the area of the skull that houses the ear. So with my big mouse here, you can see this is the outer ear that everybody gets to see. This is the ear canal. It's important to note that that ear canal has a nice S shape. This helps to keep water out of the ear and helps to protect the eardrum. You'll see these little hairs. That's what we know as cilia. Okay. Now cilia can come in a couple different forms. This is cilia that's growing through the skin. So this helps to trap any debris or anything like that, and it actually works its way back out of the ear canal in some of those cases. So we've got wax, also known as cerumen, some oil glands in here that are helping to keep everything nice and clean. What you're looking at here is the eardrum. Okay, so once we get to the point of the eardrum, that's where I'm going to switch over to the 3D model. So we've got the eardrum, the middle ear system here, the little snail shell shaped organ that we know as the cochlea, and then this is what we call the vestibule. This is the balance center of the inner ear. Then you've got the nerves that carry that information to the brainstem. This long tube is the eustachian tube. We'll talk about that here a little bit more in depth in just a moment. But that is kind of the overview of the outer ear anatomy. Now let's switch over to that 3D model and take a look a little bit more in depth in some of the components of the inner ear. Okay, we've switched over to this three-dimensional interactive model of the inner ear. This is such a beautiful tool. Again, this is the University of Dundee. All the credits are over here on the side, so if you're interested in any of this information, it's over here. I did not create this, but it is an amazing tool just to get a good visualization of what we're actually talking about. So this is, again, the inner ear. We looked at that picture last time. The ear canal would come in this way. You can see my big hand here. The ear canal would come in an S shape, and it would end here at the tympanic membrane. This is the eardrum, okay? So it's like purpley in this case. Generally, when we look into the ear, it's kind of a pearly gray or a translucent gray color. If we turn this just a little bit, you can see the little bones here, here, and here that we all learn about in grade school. So this first bone here, like if I click on it, it'll zoom in. That's the malleus. The malleus actually connects to the back side of the eardrum in two different places. The eardrum has several layers, 3 layers to be exact. 2 of them are skin layers, epithelial layers, and then the inner layer is a fibrous layer. That fibrous layer intertwines around the bone connections here of the malleus and allows everything to move and be connected really, really well. So if I turn this around, I'll go slow so we don't get too lost. This is, as you can see, the incus. Change my angle. The incus is the second or the middle part of the chain. You can see it almost looks like a knee joint. There's a little connection point there in that incus. Then we'll turn it right around. And then this little guy is also known as the stirrup, but what we know in the medical field as the stapes. The stapes acts like a piston. It pushes in and out of the cochlea through a little window that is basically covered by a skin layer or a membrane there. So as this pushes in and out, it creates a fluid wave. That fluid wave then travels up the cochlea. So this here is the cochlea. It looks like a little snail shell. I'm going to turn it a little bit. There's usually about 2.5 turns. And you can kind of see there's 1, 2, and then the half turn there. The cochlea is a really, really amazing organ. Now, I won't get really in depth into the cochlea right now, but this is amazing. This is an amazing organ. The fibers that are found here at the bottom or the beginning of the cochlea are all representative of high frequency sounds. And as you go further down the cochlea, those sounds get deeper and deeper. And then the very tip top here are low frequency sounds. Okay? If we turn this around a little bit, you'll see all of these nerve connections. All of these nerve fibers, we'll zoom in here a little bit. Oh, this tool is awesome. I love it. All these nerve fibers will terminate up through the middle of that cochlea. And there are other little cells in the cochlea that respond to that fluid wave. They turn that fluid wave into an electrical potential or an electrical impulse. And these nerves carry that electrical impulse, or nerve fibers, carry that electrical impulse up the vestibulocochlear nerve, or the 8th cranial nerve, or the auditory nerve, to the level of the brainstem. The cerebellar pontine angle is where that connects to the brainstem, and then it goes up the brainstem to the brain. The brain then interprets the sound. So if I keep turning this around a little bit, what you'll notice is that nerve splits. There's the cochlear portion that goes over here that is in charge of hearing. Then there's this side that comes over and connects to the back of the vestibule. And you'll see there's 3 connection points. 1, 2, 3. Each of those connection points comes up into one of these little bulbs. Okay, and there's a couple of those at the base of each of these canals. These are called semicircular canals, and they basically represent the peripheral vestibular system. They're in charge of your balance. There's more to the balance system than just the inner ear, but this portion of the inner ear is what we is a large part of our balance testing. Okay, so you've got the semicircular canals, you've got the superior canal. Let's zoom out a little bit and get it all on the screen. The superior canal, okay, the horizontal canal, and then the posterior canal. Okay, so they're named kind of based on how they are oriented in the inner ear. Then make a little turn there. This big nerve that wraps around those ossicles or middle ear bones kind of snakes around like that. That, as you can see here, is the facial nerve. That facial nerve then follows the vestibular cochlear nerve into the brainstem. So the 2 portions of the 8th cranial nerve and then the 7th cranial nerve all go right through a little canal called the internal auditory meatus to the brainstem. What a fascinating organ this is, okay? So, as we were talking up to this point, with the standard hearing test, we're actually testing how well this organ, or the cochlea, is working.
And in a future video, maybe we'll get really into the inner workings of all the parts and pieces of the cochlea. I think the anatomy is really interesting and intricate and important. But for now, that's what we're testing when we're testing a standard hearing test. We're testing how well each portion of the cochlea is working based on the frequency or the pitch that we're testing. Now, that information is carried up the nerve, which we are testing when we are doing acoustic reflexes. Now, we talked about acoustic reflexes in our second video in the series. In the same testing that we're using with acoustic reflexes, we're testing tympanometry, or how well the eardrum's moving, okay? So just to summarize up until this point, tympanometry is first, generally. We test to see how well the eardrum's moving, to make sure there's no fluid behind that eardrum space. Once we can confirm that that all looks great, then what we're doing is we're testing acoustic reflexes. So acoustic reflexes will put a sound into the ear canal that's then vibrating the eardrum, vibrating the 3 bones that are known as ossicles. Then we take that sound that we're putting in there, push it up through the cochlea, it goes through the nerve, goes up to the brainstem, and then comes back down as a voluntary response called an acoustic reflex. That reflex travels down the 7th nerve to, you can see this is kind of innervating right through that middle ear space. There's a portion of this nerve that activates a muscle connected to these bones. So you can see with that acoustic reflex, we make a big loop, and we can test how well that loop is working. That's why we use acoustic reflexes, testing the middle ear system before we do our hearing test. So I will be using this 3D model just to kind of illustrate some of the other things that we're doing and kind of pointing out what we're actually testing. This is a new feature that I found online. I absolutely love it. It's really, really cool. And I hope that you've enjoyed it as well.
All right, everybody. Hope you enjoyed our episode today. If you did, leave us a comment, like the video, subscribe to our channel, all that good stuff. If you have questions, email us at info@hearwv.com or call the office at 304-428-2403.
Until next time.
Thank you.
See ya.